Welcome to Nurs 352. Our course title is Advanced Clinical Nursing 1. This course is designed to equip students to be able to identify diagnostic investigations of the integumentary, cardiovascular, respiratory, gastrointestinal, and genitourinary systems. You are expected to set trays and trolleys for these procedures. Is designed to prepare you for medical and surgical procedures of these systems, carry out various procedures of the integumentary, cardiovascular, respiratory, gastrointestinal, and genitourinary systems, and then apply your knowledge. You are also expected to apply your knowledge in anatomy and physiology, medical surgical nursing, and Nurs 337. You are also expected to work at the medical surgical wards for at least 6 weeks, and to enable you gain more practical experience, you can also be having your private practical sessions with your colleagues at your free times. So our first session, which is session 1, deals with the various medical and surgical procedures of the integumentary system. And at the end of this session, students will be able to identify the various types of wounds. You should be able to carry out wound dressing of all types of wounds, with or without assistance. You should be able to remove surgical sutures, staples, and drainage tubes without causing harm to your patients. And you should be able to set up and prepare patients for incision and drainage, and also assist doctor carry out these procedures. Briefly, we'll look at wounds and wound dressing. What is a wound? A wound is a break in the continuity of the skin, mucous membrane, or tissues. Now, when we take classification of wounds, wounds are classified by 1, the mechanism of injury, and then 2, degree of contamination. When we take the classification according to mechanism of injury, we may have open and closed wounds. Now, an open wound is a type of wound in which the ligaments and blood vessels are open to the outside, and examples include incised wound, a lacerated wound, and an abrasion. Closed wounds, on the other hand, are wounds in which the ligaments and blood vessels are closed and there's no communication with the outside of the skin. Examples of these wounds include contused wounds, and then we also have blisters and sprains. Now, when we come to the second classification, that is according to the degree of contamination, we may have clean wounds. These are surgical, unaffected wounds without any inflammation. So we may have clean, contaminated wounds. We also have dirty or septic wounds, and we also have clean but contaminated wounds. So we have 3 types. We have the clean wounds, clean contaminated wounds. These clean contaminated wounds are normally found with wounds of the GIT or gastrointestinal tracts and other body parts, which have a higher probability of getting infected. And the dirty or septic wounds are known as infected or severely infected wounds. There's microorganism invasion. So the wound has a lot of discharge and is sloughy. Now let's look at principles of wound care. 1, the nurse must ensure strict aseptic technique. And this requires that the hands are washed and sterile equipment are also used. On a ward where we have both clean and dirty or septic wounds, clean wounds must be dressed first. And all requirements should also be ready before wound dressing. Before wound dressing, dusting and cleaning of the ward should be done before the wound is dressed. 2 nurses may be required if the need be. The nurse must also wear mask as part of ensuring aseptic technique. Dressing should be changed frequently, especially if the wound is discharging, and the same instrument should not be used for the next patient. Now, why should we dress wounds? Purposes of wound dressing. 1, wounds are dressed to aid in hemostasis, and that is, it helps arrest hemorrhage because the pressure dressing applied to the wound will help prevent bleeding. It is also done to promote healing, absorb drainage from the wound, to debride the wound if necessary, and also to protect the wound from microorganisms. It also helps in supporting splinting or immobilizing the wound. And finally, when a patient's wound is dressed, it's a sort of comfort. So it provides physical and emotional comfort to the patient. Now we want to come to the wound dressing procedure. The nurse is responsible for dressing wounds, and as mentioned earlier, we have the various types of wounds, and we have solutions used in dressing these types of wounds. The nurse, before wound dressing, is supposed to get all her requirements ready by setting the dressing trolley. Now, to set the dressing trolley, it has to be sterile. So first of all, the trolley is washed, what we will call bathing of the trolley, after which it is rinsed, and then it is also disinfected. Then the general condition of the patient as well as the size of the wound is also assessed before the dressing. Doctor's instructions regarding the wound dressing should also be read before dressing is done. Now, later on, we will demonstrate. But on our dressing trolley, we have the sterile top shelf and then the non-sterile bottom shelf. Ideally, everything or all the requirements for the wound dressing are supposed to be on the bottom shelf, so that when you are ready for dressing, the sterile top shelf is set at the patient's bedside. Now, on the top shelf, we need sterile dissecting and dressing forceps. We may need a sterile syringe in case the wound has to be irrigated. Then, if it's a deep wound which has to be packed, we also need a sterile sinus forceps and a probe. The sinus forceps will help with the packing, and the probe is to take the depth of the wound to know how deep the wound is. We need 2 sterile gallipots for our lotions. We also need 2 receivers or kidney dishes for our cotton wool swabs and our forceps. Now we come to the bottom shelf of our trolley, which is considered clean but not sterile. On our bottom shelf, we have our dressing pack, and this dressing pack will later on be used in setting as a sterile top shelf. Then we also have our cotton wool and gauze swabs. We have a receptacle for the used or soiled dresses or cotton wool swabs. We also have a receptacle in which we are going to put our used or soiled forceps, a dressing Macintosh and towel to protect our bed. We also need a box of masks. The lifespan of the mask is 15 minutes. After 15 minutes, it becomes wet and moist and favorable for microorganisms. We also need sterile gloves, disposable gloves, the prescribed lotion or solutions. These lotions include normal saline, We also have povidone solution. Now, sometimes the normal saline is used in cleaning the wound, while the povidone is used in dressing the wound, especially in dirty wounds. Other solutions may be used for the wound dressing, as well as other medications or substances depending on the type of wound. Then still on our bottom shelf, we also need syringes and needles as may be required for drawing our solutions or normal saline solution. Now, to come to the dressing or the procedure itself, the wound may be dressed with or without an assistant. If the wound is being dressed with assistance, the responsibilities of the assistant are: 1, to ensure the positioning of the patient, help with the provision of privacy, help with the protection of the bed, and then the assistant is also going to help with pouring of lotions and the release of plaster on the wound. That is the old dressing. All other things are done by the dresser or the one who is going to dress the wound. If you are doing it alone, then it will require that you do a lot of hand washing, because the same nurse protects the bed, positions patients, provides privacy as well. Now, when we come to the procedure itself, so that was a general overview of wounds and principles regarding wound dressing. To end this session, we've defined wounds, we've looked at the various types of wounds, principles for wound dressing, purposes for wound dressing, and the responsibilities of the nurse before wound dressing. So we now move on to the practical aspects, and that is dressing of the wound, the procedure itself. Okay. Now, before the wound dressing, the procedure is supposed to be explained to the patient. So, good morning, Mr. Osei. I am Nurse Anson, and this morning I'm here to dress the wound on your hand, as we've been doing every morning. Today I came with one of my colleagues. She's also Nurse Jancy, and she's here to assist me perform the wound dressing. And as we always do, we are going to use forceps, what are instruments that looks like scissors. Don't be afraid, we are not going to hurt you. You will experience some discomfort, but the procedure will be over soon. The wound is being dressed to aid in early healing, so that we'll be able to go home early, recover quickly, and go home early. My assistant is here to provide the necessary assistance. So she is going to see to it that she positions the hand for me, and then also expose the sides by removing your cloth and the bed clothing. I hope you are going to cooperate with us. Now the nurse is supposed to wear a rubber apron to protect the uniform as well as the mask. The mask is worn throughout the entire procedure in preparing the trolley and then carrying out the procedure. So after the procedure is explained, the next step is to wash the hands thoroughly. Paying particular attention to the nail bed in between the fingers and the palm of the hand. So after the hand washing, my able assistant positions the patient for me and then protects the bed. So this is wound dressing technique with 2 nurses or with an assistant. So the assistant has now provided privacy. The old plaster which was applied to the wound has been removed, leaving one of the gauzes. If the entire gauze is removed, then we cover the wound with a fresh gauze. The wound is not supposed to be laid bare. Now the procedure. We have a sterile field protected with a sterile dressing towel. So it's time to set up the sterile field. These instruments are sterile, and therefore our hands are not supposed to touch them. But we have a sterile piece of paper inside the instruments which can be used in touching the gallipots and the receivers. So we have our instruments. The instruments should be arranged in such a way that they all face one direction. Nursing is an art. So our two receivers or kidney dishes will be on each side of the trolley with the gallipots in the middle or in the center. And then we have our dressing forceps. Please know how to drop your swabs without contaminating the sterile portion of the trolley. So we have our cotton wool swabs for the cleaning and our gauze swab. You look at the size of your wound so you don't contaminate the swabs. The assistant now comes in to pour the lotion whilst I wash my hands for the last time because I'm about to start with the procedure. The syringe is not supposed to touch any of the things on the sterile portion of the trolley because we want to prevent wound infection. 2 or 3 gallipots may be used depending on the number of solutions required for dressing the wound. For some septic wounds, normal saline is used, hydrogen peroxide is used in softening the slough, after which the wound is cleaned with normal saline and dressed with povidone solution. In that instance, then we will need more than 1 gallipot. So it's now time for the wound dressing. Mr. Say, I came to talk with you a few minutes ago that I was going to prepare and come and dress your wound for you. I am now ready, so I have brought my things and I'm about to start with the procedure. We have a dissecting forceps and an artery or the dressing forceps which is going to be used in dressing the wound. The dissecting forceps in this case is seen as the sterile or the clean forceps because that is not coming into contact with the wound. So you pick the swab with the dissecting forceps, and then you dip in the lotion, squeeze it, and arrange the swab nicely on the dressing forceps and dress the wound. But before I go on with that, I need to remove this old or sour dressing using one of the dissecting forceps. This forceps is now contaminated, so I need to drop it in my receptacle for instruments. My hands are still clean because it hasn't touched any contaminated item. The forceps is sterile. Now we come to the actual dressing. For a clean wound like this, the wound is cleaned from within outward. So the inside of the wound is cleaned first before we come to the surrounding area or the outside. If it's a discharging and septic wound, then we clean the outside of the wound first before we come to the wound itself. Because it's a clean wound, we are going to go from within the wound outwards. So you pick your swabs. Please desist from putting all the swabs in the solution at once. You pick one swab, dip it in the solution for the dressing. If the wound is infected, then you squeeze into another receiver or gallipot. But for a clean wound, we can squeeze into the same gallipot. Make sure you have enough lotion and make sure the tip of the swab is covered entirely or totally so that the forceps will not touch the patient's wound. Leave the dissecting forceps on the sterile field to avoid contaminating it. So we now come to the cleaning itself. Sorry, Mr. Osei, it's not comfortable. I know you are going to feel pain. Please, you clean using one surface of the swab once. With experience, people are able to turn, but please, as a student, use one surface of the swab once, and then you release it into the receiver. As you do that, you make sure you don't contaminate the forceps. So we continue cleaning the wound until it is very clean. Clamp the forceps, making sure the tip of the forceps is covered. Please, it should be firm, but don't sweep the wound and don't also dab. Give it a firm pressure, making sure you clean to remove all dirt and slough. All this place is sterile. That is why we can leave our dissecting forceps here. Because we've started using it, we don't want to go back to the sterile ones. My wound is still dirty. There are still discharges. If you want to open, sometimes students struggle. They have to use their two hands to press before they open the forceps. It is very simple. With your middle finger and the thumb in the two holes, you place your forefinger here to help with the opening and closing. When you are opening, you just lift and it opens. Don't struggle. You just give it a little shake and the swab is in the receptacle. Okay, so now that we are done with the inside of the wound, we now come to the outside. We clean the surrounding areas in the same fashion as we did. The wound itself is not dried, but because we are going to apply adhesive tape or bandage, the surrounding is dried after cleaning. So the surrounding area of the wound can now be dried. This forceps is now considered contaminated because it was used in cleaning the wound. But the dissecting forceps is still clean because it hasn't touched the wound, and therefore we are going to use in applying the dressing to the wound. So again, we put it in the receptacle for used instruments.